Hi, I'm Dr. Raj Sinha. I'm an orthopedic surgeon specializing in hip and knee replacement, practicing here in Palm Desert, California at Star Orthopedics. I've been in practice for 22 years, the last 16 here in the desert. I've had the good fortune of being involved in designing implants for several different companies, and I've been asked to talk a little bit about the recovery after knee replacement. As you can imagine, we do about 2 million knee replacements in this country per year. So a lot of people are getting them done because they want to get back to an active life. But the question is, how active can they be and how fast can they get there? Let me take you through a typical scenario. With all of our pain management strategies that we do, people actually get up and walk the day of surgery. They start off on a walker. Typically, they'll be in the hospital overnight. A lot of times we'll send people home the same day because the pain control is so good and the medicine has gotten so good that they can actually go home safely the same day. I ask people to be on their walker for about 10 to 14 days, not because they absolutely have to, but because I want a safety margin. You're still on pain medications, there's still swelling issues. I want that safety margin. Somewhere around 14 days, you can go from a walker to a cane. Now, in my experience, once you're walking comfortably with a cane, if it's your left knee, you're probably safe to drive. There's research that suggests that it takes about 6 weeks after surgery to get all of your reaction time back to normal, probably because of the pain medication and things like that. So somewhere between 2 and 6 weeks, you can drive after the surgery. You'll be doing physical therapy for a total of about 6 to 8 weeks after the operation. And it's important that you do that therapy because we want you to hit certain targets by that point. You will need to continue exercising, especially your quadriceps muscle, for about a year because it takes a full year for that muscle to come back all the way back to its normal strength. Partly because it was weak going into the operation because you've had debilitating pain for a long time, partly because of the trauma of the operation itself. In terms of sports and other activities, it really depends upon several things. It depends upon what type of implant was used, it depends on how good your knee feels, and it depends upon your overall health and your ability to protect yourself. For example, I had a patient who had a knee replacement and felt so good that 1 week later he went out and played golf. He tweaked his back because he was worried about hurting his knee. So it's not that you can't do it, it's just not recommended to go back that quickly. So typically I tell people somewhere between 4 and 6 weeks is when you can start getting back into light sporting activities. Walking certainly earlier than that. But things like chipping and putting if you're a golfer, hitting from a ball machine if you're a tennis player. Pickleball is a little bit early at that, 4 to 6 weeks to get back to it. Most of my patients tell me that around 3 months is where they feel really comfortable getting back to sports, whatever the sport is, cycling, hiking, tennis, golf, because by that point, they're not thinking about the knee anymore.